Scientists in the US have unveiled results of a small clinical trial that could mean an effective cure for sickle cell anemia, the painful and debilitating disease that inflicts many millions of people across the globe, mostly of African heritage. Researchers at the National Institutes of Health say they have used gene therapy techniques to add a corrected gene for healthy cells into the bodies of 9 test patients, replacing their diseased red blood cells and effectively ridding them of signs of the disease.
The gene therapy that has now been applied to a small number of patients as part of a clinical trial seems to have worked spectacularly. These patients who had sickle cell disease, now when you look at their blood counts and their blood smears, it looks like they don't have it anymore. Now, it's early days. We've only followed these patients for a year at the most, but it looks like it would be fair to say this could be a cure.
Sickle cell disease is an inherited blood disorder that causes protein crystals to form inside red blood cells that then clog up the small blood vessels, resulting in terrible episodes of pain and organ damage. Sufferers often face stigma.
But for me, it feels like my body is starving for oxygen. And it's suffocating, you know what I mean? I feel myself dying.
In the clinical trial, a normal copy of the gene with the correct spelling for healthy red blood cells was placed inside a virus that allowed the good gene to multiply many times over. Within 2 or 3 months, the 9 patients showed signs of remission and were starting to discover normal health for the first time in their lives, according to the researchers.
Patients with sickle cell disease, at least the adult patients with sickle cell disease, have hemoglobins of 7. And, to have their hemoglobin go up to normal, and then to look inside the red cell and see what kind of hemoglobin it is and find it be derived from, the vector that we put in their cells was just extraordinary.
There is no universal cure yet for sickle cell anemia, and most of the current treatment is limited to simply pain management. But with this research, there is hope that a cure may be on the way for millions of sickle cell patients in Africa.